Hello, friends. Welcome to another episode of Dr. Sachin's podcast. And this time, we are going to continue what we started last week, that is, discussion of serum tumor markers. We had a general introduction about what tumor markers are and how they should be used. This week, we are going to start with one particular tumor marker which is commonly used called carcinoembryonic antigen. In this podcast, we will discuss its uses and some of the things for which it should not be used. But as is our custom, before we go on to the podcast, let's discuss what happened last week. Last week, of course, was Dussehra, which was celebrated in a diverse countries like India in different ways in different parts. So, Ravan Dahan was done at number of places. In West Bengal, there was Durga idol immersion and something called Sindur Khela, where women played with sindur, that is vermilion, just like they do at the time of Holi. So, here is wishing happy Dussehra to all of you from me. Next news that caught my attention was this news, which had me and my son drooling. Airtel was selling iPhone 7 for rupees 1909.90 only. But we came to know that there is a catch in this, as it is clarified in an article in Indian Express. This scheme was only for Bharti Airtel employees only. But they have one more scheme whereby you can lease iPhone 7 for under 20,000, but then you end up paying about the same amount at the end of 1 year. I'm still not very clear about the scheme, and as they say, market investments are subject to risk. So read the offer documents carefully before investing. So you also read what the offer is very carefully before going on to this. So with this, let us go to our own subject and start discussion about carcinoembryonic antigen. To introduce, it is used for monitoring colorectal cancer and selected other cancers such as medullary thyroid carcinoma. It may be useful in assessing the effectiveness of chemotherapy or radiation treatment. But we have to remember that carcinoembryonic antigen levels are not useful in screening the general population for undetected cancers. It's not that we can go about testing everybody and check whether there is a cancer or not. Now to go into more details, what is carcinoembryonic antigen? It is a glycoprotein normally found in embryonic endodermal epithelium. Where it is found? Embryonic endodermal epithelium. So increased levels are found in cancers that develop in organs that develop from this endodermal epithelium, and those include primary colorectal cancer and other malignancies including medullary thyroid carcinoma and breast cancers, gastrointestinal tract cancers, liver cancers, lung cancers, ovarian cancers, pancreatic cancers and prostatic cancers. But we have to remember that serial monitoring of CEA should begin prior to therapy to verify post-therapy decrease in concentration and to establish a baseline for evaluating possible recurrence. So the benefit of monitoring CEA levels prior to therapy is we can now verify the decrease in concentration, and we get to establish a baseline for evaluating the possible recurrence of the disease. We have to know that levels generally return to normal within 1 to 4 months after removal of the cancerous tissue. We have to note that gross elevation, that is values above 20, in a patient with compatible symptoms is strongly suggestive of the presence of the cancer and also suggests metastasis. So value above 20 is the red signal in a compatible setting and may also suggest metastatic disease. Most of the healthy subjects have values less than or equal to 3 nanogram per ml. After removal of the colorectal tumor, the concentration should return to normal by 6 weeks unless there is residual tumor. So persistence of CEA levels beyond 6 weeks, we can understand that there is a possibility of a residual tumor. Then increase in test values over time in a patient who is already diagnosed with a history of cancer suggests tumor recurrence. So increase in values suggest tumor recurrence. We have to be cautious that CEA should not be used to screen asymptomatic individuals for neoplastic disease. It should be done only in symptomatic individuals in the right clinical setting. Single values of this CEA are less informative than changes assessed over time. We also have to remember that CEA values are method dependent. Therefore, the same method should be used to serially monitor patients. We have to note that we should not interpret CEA levels as absolute evidence of the presence or absence of malignant disease. We have to use serum CEA levels only in conjunction with information from the clinical evaluation of the patient and other diagnostic procedures like radiography. We also have to be cautious of the fact that some patients who have been exposed to animal antigens, either in the environment or as part of treatment or imaging procedures, may have circulating anti-animal antibodies. And what these antibodies do, these antibodies may interfere with the assay reagents to produce unreliable results. So if we find that our CEA levels are not matching the clinical pictures, this is one of the possibilities that patient may have some pets, or patient may be from a rural area having cattle or something where there is exposure to animal antigens, and he has developed antibodies against that antigens, and these antibodies are now interfering with the assay procedure. Assay procedure commonly employed is chemiluminescence immunoassay or enzyme linked fluorescent assay, and in this there can be interference of these antibodies leading to unreliable results. So with this, we have summarized the important facts about carcinoembryonic antigen. I hope you like this summary of carcinoembryonic antigen, and with this, myself, Dr. SAchin Kale, would like to take your leave. So see you next week again in another episode of Dr. SAchin's podcast. Thank you and bye.